Hi, Blood Talk fans. Welcome to today's video. In this section, we will cover some questions and answers for coagulation testing, including what additives are used for accurate results, how certain deficiency affect clotting testing, and the role of thrombin in regulating clot formations. Whether you are a student or healthcare professionals, we will break down complex concepts in an easy to understand way. Let's dive in. What is the additive used for coagulation tests? The answer is B. In coagulation testing such as PT and aPTT and other clotting factors assay, an additive is used to prevent blood from clotting so that the process can be measured in a controlled environment. The additive must bind to calcium, which is essential for blood clotting, thereby preventing clot formations in the sample. Here's the breakdown of the options. Fibrin is a coagulation used in some laboratory setting, especially in testing that involve plasma for certain type of blood tests. However, aspirin is not a typical use for standard clotting tests because it interferes with the clotting cascade, leading to inaccurate results for tests like PT and aPTT. The 3.2% sodium citrate, this is the correct answer. Sodium citrate is the most commonly used anticoagulant for coagulation testing. It works by binding calcium ion, which are necessary for the coagulation cascade to process. The 3.2% sodium cascade solution is the typical concentration used to ensure proper blood to anticoagulant ratios, which is crucial for accurate testing. 3.8% sodium citrate. Why sodium citrate is used for coagulation testing? 3.8% sodium citrate is a higher concentration typically used in blood bank and other specialized tests. The 3.2 sodium citrate is the standard for coagulation study. Sodium oxalate. Sodium oxalate is another anticoagulant, but it is rarely used for coagulation study, even though it's also preventing blood clot by binding calcium, similar to sodium citrate. The sodium oxalate is more commonly used in older laboratory testing methods or for hematology testing. For coagulation testing, the sodium citrate is more commonly used. Why it has to be 3.2%, or why do we prefer 3.2% sodium citrate? The 3.2% sodium citrate is chosen for its optimal blood to anticoagulant ratios, usually a 9:1 ratio of blood to citrate, which ensure accurate testing results for clotting assay like PT and aPTT. Sodium citrate prevents clotting by binding to calcium ions, which are required for clotting factors to activate and form a clot. What would a screening test show for a patient with fibrin stabilizing factor deficiency? The answer is D. Fibrin stabilizing factor deficiency, also known as factor XIII deficiency. It is a rare bleeding disorder where factor XIII, a protein involved in the final stage of clotting formation, is either deficient or dysfunctional. Factor XIII play a key role in stabilizing the fibrin clot by cross-linked fibrin strands, making the clot more durable and resistant to fibrinolysis, or the breakdown of clot. Factor XIII works after the clot has been formed, especially in the final stage of coagulation cascade. It cross-links fibrin molecules to strengthen and stabilize the clot. Because factor XIII deficiency affects the stabilizing of the clot rather than the formations of the clot itself. It doesn't directly impact the clotting times measured by routine screening tests like the PT and aPTT. Screening test results. PT and aPTT are part of the routine coagulation screen used to assess the initial clotting cascade, extrinsic and intrinsic pathway, respectively. These tests measure the time it takes for a clot forms in plasma after certain substances are added. In factor 13 deficiency, both PT and aPTT are typically normal because factor 13 doesn't play a role in early stage of clotting cascade. However, if the clot form is tested, it will be unstable and will break down prematurely because factor 13 isn't available to stabilize it. Diagnosis of factor 13 deficiency. The diagnosis of factor 13 deficiency is typically confirmed with spatial factor 13 activity assay, not with PT or aPTT test. The Fibrin clot stabilize test can also be used to detect abnormally clot stabilized, which would be indicative of factor 13 deficiency. In summary, factor 13 deficiency does not affect the clotting cascade in a way that prolong PT or aPTT. Therefore, the correct answer is D. Pull Thrombin times and activate partial thromboplastic times normal. What happens when thrombin binds to thrombomodulins on blood vessel cells? The answer is A. When thrombin binds to thrombomodulins on the surface of endothelial cells, it undergoes a change in activities. Normally, thrombin's primary role is to convert fibrinogens to fibrins and activate serial clotting factors such as factor V and factor VIII to promote clotting. However, when thrombin binds to thrombomodulins, it becomes active to perform a different function, activating protein C. Here how this works. Thrombomodulin is a receptor on the surface of endothelial cells, the cell lining's blood vessels that bind thrombin. When thrombin binds to thrombomodulins, it lost its ability to convert fibrinogen to fibrins and instead activate protein C. Activated protein C then bind to protein S, and together they inactivate clotting factor 5A and 8A, which are crucial for the amplifications of the clotting cascade. This process slows down clotting and acts as a natural anticoagulant, helping to prevent excessive clot formations. Why the other options are incorrect? B is incorrect because thrombins, when not bind to thrombomodulin, does activate factor V and factor VIII as a part of the clotting process, but when bind to thrombomodulins, thrombins no longer activate these factors. Instead, it activates protein C. Choice C is wrong because this is one of thrombin main functions in the clotting cascade. But when thrombin binds to thrombomodulins, it no longer converts fibrinogen to fibrin. Its primary role shifted to activating protein C. Answer D is incorrect because thrombin does play a role in platelet aggregations, but this function is independent of its interactions with thrombomodulins. When thrombin binds to thrombomodulins, its primary role is to activate protein C, not to stimulate platelets. In summary, when thrombin binds to thrombomodulins on epithelial cells, it becomes capable of activating protein C. This is part of body natural anticoagulant systems that regulate and prevent excessive clotting in our body. Which clotting factor is inherited in a sex-linked recessive pattern? The answer is B. Factor IX is the clotting factor that follows a sex-linked recessive inheritance pattern. Here's why. Factor IX is enclosed by a gene located on X chromosome. Sex-linked recessive inheritance means that the gene causing the disorder is located on the X chromosome, and males who have only one X chromosome are more likely to express the condition if they inherited the defective genes. Females have two X chromosomes, so they would need to inherit two copies of the defective genes to express the condition, though they can be carrier with only one copy of the genes. Hemophilia B, also known as Christmas disease, is caused by deficiency or defect in factor IX. This condition is inherited in a sex-linked recessive manner, affecting primary male, although females can also be affected if inherited defective gene from both parents. Why the other options are incorrect? Factor V is inherited in an autosomal pattern, not X-linked. This means it's located on one of the non-sex chromosomes and is inherited equally in males and females. Factor X is also inherited in autosomal manner. Like factor V, it's located on a non-sex chromosome and affect both male and females equally. Von Wöberlin factor is involved in platelet adherence and clotting, and it is autosomal dominant in inheritance. Both male and females can be affected by Wöberlin disease, though females may have more severe symptoms due to menstrual bleeding. In summary, factor IX is a coagulating factor that has a sex-linked recessive inheritance pattern, which is why hemophilia A, due to factor IX deficiency, primarily affecting males. Sex-linked recessive refer to a type of inheritance where gene causing a disease is located on the X chromosome. Key point: X chromosomes. Both males and females have sex chromosomes, but male have one X and one Y, while females has two X chromosomes. Recessive: for persons who show disease, they must inherit two copies of the defective genes, one from each parent if they are females because they have two X chromosomes. However, the males only need to have one defective gene because male sex-linked chromosomes compose of one X and one Y. Hemophilia and color blindness are examples of sex-linked recessive disease. A male with the defective genes on his X chromosome will have the disease. A female would need both X chromosomes to carry defective genes to show the disease. If only one X has the genes, she is a carrier. In short, a sex-linked recessive disease are passed through the X chromosome. Males are more likely to be affected by it because they only have one X chromosome. Females need two copies of the defective genes to show the disease, otherwise they are a carrier.
That's all I have for today. Did I miss anything? If you have any questions, please let me know. I'm more than happy to answer them. If I don't know, I will try my best to find out for you. Also, keep in mind that the information I put together here is the general practice at the moment. As time changes, certain practice may change, and different institutions may have different policies. So please keep an eye out for that. If you like my video and think it's helpful in any way, please share it with your friends, and I shall see you all next time. As always, remember, your blood tells you the story of your health. Thanks for watching. Bye!